Postpartum hemorrhage, or PPH, is one of the most serious complications after childbirth. But the good news is that when it's recognized quickly, it can be treated safely and effectively. Today, I'll explain what PPH is, why it happens, the warning signs, and how doctors manage it, all in a simple, calm, and reassuring way. Postpartum hemorrhage means heavy bleeding after birth, usually defined as more than 500 milliliters after a vaginal birth, more than 1,000 milliliters after a C-section, or any bleeding that causes mom's heart rate or blood pressure to drop. It usually happens within 24 hours of delivery. This is called primary PPH, but it can also occur days or weeks later, known as secondary PPH. Doctors use the 4TS to understand the causes. 1. Tone, uterus not contracting, most common, after birth. The uterus must contract tightly to stop bleeding. If it stays soft or boggy, heavy bleeding starts. This is the #1 cause. 2. Tissue, placenta pieces left inside. If small parts of the placenta remain attached, they prevent the uterus from contracting. 3. Trauma, tears or injury. This includes vaginal tears, cervical tears, uterine rupture, C-section wound bleeding. 4. Thrombin, clotting problems when the body cannot form clots. Even small bleeding becomes severe. These 4 cover almost all causes of postpartum hemorrhage. PPH can happen to a NY woman, even with a perfect pregnancy. But some women have higher risk. Very long labor, very fast labor, twin or triplet pregnancy, big baby, induced labor, placenta previa or abruption, anemia, previous postpartum hemorrhage, C-section or instrumental delivery, infections, use of certain medications. However, even low-risk mothers can experience PPH, which is why every delivery team prepares for it. Here's what doctors and nurses watch for. Bleeding that soaks more than one pad in 15 to 30 minutes. Large clots, bigger than a golf ball. Dizziness or fainting. Drop in blood pressure. Fast heartbeat. Pale skin. Cold hands. Uterus feeling soft instead of firm. Continuous trickling of blood. If any of these appear, immediate action begins. Treatment is fast and systematic. Step 1. Massage the uterus. A firm massage helps the uterus contract and reduce bleeding. Step 2. Medications doctors give. Oxytocin, misoprostol, ergometrine, carbetocin. These drugs help the uterus tighten. Step 3. Remove retained placenta or clots. If tissue is inside, it must be removed to stop bleeding. Step 4. Repair tears. If trauma caused bleeding, stitches are done quickly. Step 5. 4 fluids plus blood transfusion. These stabilize blood pressure. Step 6. Advanced procedures if bleeding still continues. Balloon tamponade, balloon inflated inside uterus. Uterine artery embolization. Surgery, rare but life-saving. Doctors are trained to act within minutes, and these steps save countless lives. Yes, and doctors already work to prevent it, giving uterotonics immediately after birth, controlled delivery of the placenta, monitoring bleeding closely for 1 to 2 hours, treating anemia in pregnancy, knowing high-risk mothers ahead of time, keeping blood supply ready in emergencies. Mothers can help by reporting any unusual bleeding or dizziness immediately. Postpartum hemorrhage is serious, but modern medical care makes it highly treatable when identified early. The key is awareness, quick action, and proper monitoring during and after delivery. Most women recover completely and go on to have safe pregnancies in the future. If you want videos on early signs of labor, normal versus abnormal postpartum bleeding, or postpartum anemia, comment below.